Good morning or good afternoon, depending on when you're watching this. My name is Julianne Whitson, and I'm the Health and Wellness Coordinator for the Everett Public Schools. Many of you are aware that I've been assisting the district in creating the COVID-19 guidelines and responding to possible and confirmed COVID-19 cases. I've been asked today to provide a refresher for staff on the procedures, policies, and protocols related to COVID-19. We will try to provide a fresh introduction or refresher and not duplicate the webinar from the Summer Institute too much. If you are interested in viewing that webinar, you may find it on the Everett Public Schools website. And you can also find our COVID-related health and safety guidelines there. I'd like to introduce Julie Giangregorio, Sabrina Ferracano, and Frances Canty. They will be joining me in this Q&A format today. Julie, would you like to introduce yourself first?
Hi, everybody. I'm Julie Giangregorio. I'm the e-manager here with Everett Public Schools. I oversee 6 e-learning centers, and I also help with the registering of students into our e-learning centers.
Great. Sabrina?
Hi, everyone. My name is Sabrina Ferracano, and I'm the Executive Director of Health and Human Services for the City of Everett. I'm also the public health nurse for the health department and oversee the school nurses that are in each of the school buildings.
Great. And finally, Frances.
Hi, my name is Frances Canty. I'm the Director of HR for Everett Public Schools. And as you know, if you have any questions, concerns about your leaves, as well as anything dealing with your personnel matters, I am always available to please reach out to me.
Terrific. So most of you are aware that Everett is currently in the red zone and that COVID-19 cases are currently on the rise. Sabrina, can you talk a little bit about the prevalence of COVID-19 in Everett now and what trends we're seeing?
Yes, definitely. Thank you, Julianne. So like Julianne mentioned, Everett is a red community, and what a red community based off of the DPH guidelines, that means that we have an average daily case rate over the last 14 days of 8 cases or more. So we do post the numbers every day of cases that we see in the city of Everett. So that makes us a red community because every day for the past 14 days, we have been seeing over 8 cases per day. We are seeing the 30 to 59 age range more prevalent in the city of Everett, but we are seeing a mix, but we are still a red community. So we want to make sure that we're all practicing all of our preventative measures.
And speaking of, what would you say are the best ways to prevent the spread of COVID-19 in the community and at work?
Definitely, yes. So you want to properly wear your mask, properly social distance by staying 6 feet away from others, staying home when you're sick, or reporting to your supervisor or anyone at the school that you are sick and that you should stay home, and really determine where you go kind of after hours or even in the school building, but either after hours, it's really important to not attend like large gatherings and kind of take all of those preventive measures when you leave the school building as well.
Great. Speaking of masks, I've been asked to discuss what masks are appropriate and how to appropriately wear a mask. If you are anything like me, you have hundreds of masks at home. I know that my son and his baseball team, they wear gaiters, which go around the neck and they are pulled up. These are not appropriate face coverings for work in the Everett Public Schools, and neither are bandanas. So some people will use bandanas around their face. These are not considered appropriate face covers, and neither are people wearing scarves around their mouth. What we need to be seeing are paper masks. I like this one because it has a little nose clip to help keep it a little bit tight. Homemade masks, cloth masks are fine. And also ones that you buy at a store. So this mask, and obviously I'm encouraging voting on election day. I like this because it has a little string that you can tighten it. It's really important that your mask be up above your nose and covers your chin as well, and it fits snugly. You should not have your mask below your nose. You should not have your chin exposed, And obviously we shouldn't have our masks down here or hanging. So it's really important that whenever you are in an Everett Public School building, you are wearing your mask properly. Some people have asked, well, if I'm in a classroom or an office by myself, do I need to wear a mask? I mean, I think common sense tells us that if you are completely alone, that is fine. But whenever someone comes into your office, and I know a lot of the offices are small, or into your classroom, you should be putting your mask back on to have a conversation with that person. Does anyone have anything to add about mask wearing? Okay, great. Although most teachers are working remotely right now, some staff are in person teaching, working in the schools in another capacity, teaching remotely from the school, or proctoring e-learning centers. Let's talk about what these people should be doing while they're in a school building. Julie, what are the duties and requirements of e-learning center proctors, and what are they expected to not do?
Thank you very much. So Julie, a proctor's role is to supervise students, not to teach them, and to provide them limited tech support. They should be limited with their interactions. They should also be 6 feet apart. With each student, they should be spending less than 10 minutes a day with individual students. If necessary, staff should really be rotating just to limit exposure. So just to limit exposure time with an individual student, most students should support, most student support should be given from a 6 feet distance. You should be washing your hands and sanitizing after touching a student's Chromebook or even just touching their desk. We want to be as safe as possible. It is a proctor's responsibility to ensure that they are not a close contact of any student and even their fellow staff members. Teachers should also know that ELC proctors are not responsible for students' academic progress. Those conversations should still be had between the teachers and the student's parent or guardian.
Yeah, I think that's really important because I know that there's been some confusion about, if the proctors are responsible for teaching and making sure that students get their work done, which they're not.
Right.
As one of the e-learning center managers, if staff want to create some sort of a system for rotating who they talk to, who they support, can they just go do that in their individual e-learning center?
Absolutely.
Each center should just sort of come up with their own system to ensure that they're not spending too much time with a single child.
Absolutely. If they have their phones or their watches on them, they should really be paying attention to the time. Also, another trick or tip to kind of limit the close proximity between a proctor and a student, I think that proctors should have a binder, as well as I know most of the proctors do have index cards taped to each student's desk. But if they had a binder made up of their students' information with their students, all students' emails, passwords, the grade that they're in, and their teachers, I think that would also help limit exposure as well, because then you're not spending as much time, if you're troubleshooting, going over that index card while being closer to the student. You can at least take the student's Chromebook back to the proctor's desk, wipe it down, grab your own binder, and be able to troubleshoot and give the Chromebook back to the student.
So I think you sort of just answered my next question about younger children. The older middle school and high school students tend to be more tech savvy. And my question was, how do we limit exposure with these younger students who might need more tech support or even more emotional support?
Right. So like I just said, I think that if we are taking away the Chromebook and bringing it back to our desk and only going back to the student and asking them the necessary questions that we need in order to move forward and get the students rolling, then I think that's probably going to be the most successful way to keep yourself and the student safe. So taking it back to the proctor's desk, and if the proctor absolutely has to be next to the student. I think that it should be for like a quick situation, like getting a student from one Zoom link to the next. Typically that only takes like 3 minutes, depending on where the link is. I know that in some cases it can be a bit longer, but typically that's a quick fix. So
Great. And if staff finds that it's not a quick fix, maybe they can reach out to you or Juan, the other e-learning center manager, to try to get a better system in place.
absolutely, we're always open. So
Some students speak English as a second language or need additional support. Should staff members be asking students to translate or provide this additional support?
no. So we do have family liaisons at almost every e-learning center. Some of them are in the actual e-learning centers and not in like the main office. So it is easy to utilize them at some points in time to just, help navigate the situation. But sometimes the family liaisons do have their own meetings and have to go and leave the e-learning center for whatever reason. So if it is absolutely necessary for a student to be the translator, the student should either one, remain in their seat and help the proctor who is 6 feet apart from that student, as well as the student that is translating or needs translation, and interact that way. Or if there is a situation where a student who's translating is on the other side of the room, they should come 6 feet apart from the student that they're helping, as well as the proctor, and make it a quick and brief interaction and going right back to their seat after the fact.
Great information. Thank you. Sabrina, what should we expect other staff to be doing if they're working in an EPS building?
Okay, yes. So any staff members that are in an EPS building, they want to practice all of the social distancing. So it's really important to stay 6 feet apart, not congregate with other staff members, even in the e-learning centers. Really just stay 6 feet apart from other staff members, students. And if they're eating in the e-learning center, definitely remain 6 feet apart, because masks will be coming down when students are eating, when staff are eating. If staff are able to go to another room in the event that they're eating lunch, to make sure that they're 6 feet apart from any other staff member. When no one is eating or not taking a mask break, you want to have your mask on, covering both your nose and mouth and chin, like Julianne had demonstrated earlier. And if you're not feeling well, you want to report to your supervisor or your school principal, whoever you report to, that you're not feeling well, and that you should not be reporting to the building if you're experiencing any COVID-related symptoms. And I know that a lot of school members or student staff members would like to get tested, and we encourage getting tested. And we do have the Stop the Spread sites in Everett. We do test Monday through Saturday throughout the city. It's just very important, if you're not exhibiting any symptoms and you're just testing just to know and to be aware of your status of being either negative or positive, you really want to be tested on a Friday, so that you're getting your results over the weekend and you're not in the school building when you receive your results. So that's key, is to be tested on a Friday. You can get your results over the weekend, and you'd be able to return to work on Monday.
Great, thank you. And what about in-service staff working with students with special needs or disabilities or behavioral issues? They may not be able to maintain 6 feet of distance. What should they do?
Definitely. So they should be wearing their masks and their proper PPE while in the school building. They can also wear face shields. And if the staff members do not know where their face shields are or do not have access to them in the school building, they should contact Steve Bond, and he would be able to get them face shields, because with students, it may be difficult to remain that 6 feet apart. So you just want to have that extra layer of protection.
Great. Another area where there's been a lot of confusion and concern involves close contacts when there is a positive case. According to DESE, if a student or staff member tests positive for COVID-19, their close contacts will be defined as only those who have been within 6 feet of distance of the individual for at least 15 minutes while the person was infectious. The infectious period begins 2 days prior to symptom onset. If someone is asymptomatic, the infectious period is considered to begin 2 days prior to the collection of their positive test. While previous guidance stated that all students in an elementary classroom would be defined as close contacts, this new guidance provides a narrower definition of a close contact, which mirrors DPH guidance. So I have found that when there is a positive case, a lot of staff freak out and get really nervous that they are in fact a close contact. I'm not a medical professional, but I do rely on the expertise of Sabrina and the Department of Public Health. And we've really used their guidance when creating these guidelines. I think, and so if we tell you that you don't meet the definition of a close contact, it's because you don't. So we don't want to put any staff at risk. So we are really careful about following the DPH guidance. I think the more closely that individuals follow the social distancing and safety guidelines, the more comfortable you'll be returning to work if there is a positive case. When someone is identified, however, as a close contact, we can utilize the Families First Coronavirus Response Act, or FFCRA, which requires employers to provide employees with paid sick leave or expanded family and medical leave for specified reasons related to COVID-19. Frances, can you please explain how FFCRA is used on close contacts who must quarantine for 14 days?
So as you know, the FFCRA, which we call FRACA, is the federal guidelines that was passed by the federal government when the virus COVID-19 first appeared. And what the federal government did put certain guidelines in place that would help individuals who indeed needed to take time off because they were either taking care of a family and also because they might have contracted COVID as well. So the federal government set up 6 situations as to when individuals would receive FFCRA pay. And the 6 situations are defined as the following. Is when an employee is subject to quarantine or isolation order related to COVID-19, has been advised by a healthcare provider to self-quarantine related to COVID, is experiencing COVID symptoms, and is seeking a medical diagnosis. And under those 3 situations, an employee is allowed to take 80 hours of time. And that 80 hours is because you go to work 5 days a week. So 5 days, it's 40 hours a week for 2 weeks. So the federal government has mandated that that employers like ourselves have to not mark you as being, not that you're not sick, but like we will not be using this time that's allotted for you as your sick time. So your sick time will not be going towards any of this, but it will be time that that we will be marking you as COVID pay. You're in quarantine and you have 80 hours that you can use during that time. And then there are 3 other situations that the government has allowed for you to take time off, but unfortunately, the 80 hours does not go into play. You would have to use 2/3 of your you will only receive 2/3 of your salary, and that's for is caring for individuals subject to an order, is caring for a child whose schools or child care provider is experiencing some substantial conditions that are COVID related. So those are the areas that you would be covered for pay. But as I said, the first three instances is when you get the 80 hours, and the other 3 instances you do not get 80 hours. It would be 2/3 of your pay. And the other aspect of the 80 hours is once you've used the 80 hours that the government has allotted you, you do not get a replenishment of 80 hours. everyone gets 80 hours. Julie gets 80 hours. I get 80 hours. That is it. Once that 80 hours has run out, and unfortunately you get COVID again, you would have to use your sick time and or FMLA. Again, that would be using the sick time that you have available to you.
Okay, great. So if someone is told by the school that they need to quarantine for 14 days, that is great news. You would receive that federal pay. It would not come out of your sick time. And, just to, emphasize it, if you are a close contact for a second time, however, it would come out of your sick time.
Yes.
Correct. All right. And if you have childcare issues or you're caring for someone who's a close contact, you may use this time, but you will only be paid 2/3.
Yes, it will not be the 80 hours. The 80 hours does not go towards if you have childcare issues. The 80 hours is not applicable, unfortunately. You would get 2/3, but it is not 80 hours.
Oh, okay, great. We've talked a little bit about testing, and we do have a self-screening protocol for staff and students. It is critical that before coming to work every single morning, you self-screen for COVID-related symptoms. So let's talk about that and how we can respond to possible cases. Sabrina, can you please share what the signs and symptoms of COVID-19 are?
Okay, yes. So this is the most up-to-date list of signs and symptoms of COVID. They are sometimes changing or adding additional symptoms, but any fevers or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or a runny nose, nausea or vomiting, or diarrhea.
Staff members feeling ill should not come to the building, and you should notify your building principal as well as me that you are experiencing these symptoms. If you are in school, you must leave immediately. Princess, our policy is that staff that feel ill be tested immediately. However, if they decide not to get tested, they must quarantine for 10 days. If they do decide to quarantine for those 10 days, will they be paid from the federal COVID money?
So if you decide to quarantine and not take a test, you will not be paid. Unfortunately, you might just be quarantining, but the law requires that we need some type of verification that you in fact got tested. Quarantine without a test, without you taking a test, you will, unfortunately, the federal law says that you will not get paid. In every public school, we are following the federal guidelines.
But we will pay somebody while they're waiting for test results.
Yep, while they're waiting for test results, we will pay you. But if you choose not to get tested at all and just simply quarantine, unfortunately, you will not be paid. You can, of course, use your sick time that is available to you, but you will not be, you will be depleting that your sick time at that point, but you will not be receiving that federal, I guess, bypass that you would traditionally get.
All right, thanks for that information. Julie, if a staff person or a teacher notices any of these symptoms in a student, what should they do?
Call the nurse immediately and carefully follow their instructions. So once a proctor has been told to bring the nurse to the nurse's office, the proctor must walk the student down, remaining 6 feet apart. Under no circumstance should a proctor bring a student down to the nurse's office without calling them first and without getting their instruction to bring the student to their room.
Great. And it is really important that they do maintain that 6 feet of distance while walking the student to the nurse. It's important all the time, but especially when a student's feeling sick, we want to make sure that we're as far away as possible. Great. Sabrina, what if a staff member is an isolation room monitor? We do have designated isolation room monitors in every building. Will they be classified as a close contact if the child tests positive?
So an isolation monitor, if they're identified as a close contact, they will need to quarantine for 14 days from the exposure of the child. So if they were exposed on a Monday at school, they would have to quarantine for 14 days from their last exposure. And we would go over this with the nurse as well to determine anyone who was in close contact with the student for more than 15 minutes within 6 feet.
So should it be possible for someone to be in isolation room monitor and not be a close contact?
So if the isolation monitor is outside of the room and the student is inside the isolation room and they have maintained that 6 feet of social distancing and they weren't together for more than 15 minutes, they can potentially not be a close contact.
Okay. And what exactly should a close contact do when they're home? Can they go about their regular lives and just stay out of the school building, or are there special things that close contact should do while quarantining?
Yes. So when you are identified as a close contact of a positive case, you have to follow the DPH guidelines of quarantining. So that is 14 days of self-quarantining in your home. The other members of your household, if they're not on quarantine, they are able to go about their business and go to work. But the individual who is quarantining would need to stay home and would only be able to go out for either to get tested or to a medical appointment.
Great. And I probably should add, I know a lot of times we'll have students that get sent home sick because they're ill in school, and staff members, think that they're close contacts at that point. Just because a child is sick does not mean that you're a COVID-19 close contact. We wait until we receive their test results. And if the test results are positive, that's when we would do the contact tracing and make that determination. Frances, what if a person identified as a close contact wants to work remotely?
So the operational needs of EPS are different for every bargaining unit. I think the best way to if you're a close contact, I think you should call the Department of HR and we will discuss what the needs and the operational needs are. And then we can figure out whether or not you'll be able to work remotely. But the operational needs of every every bargaining unit is different, and the district has different needs for people. So it is important that you contact the HR department, and we will determine if and how you will be able to work, if you can work remotely from home.
Great, thank you. The Massachusetts travel order currently identifies the following states as low risk: California, the District of Columbia, Hawaii, Maine, New Hampshire, New York, Vermont, and Washington. As we mentioned in our previous webinar, staff travel is discouraged at this time. However, if a staff member does travel out of state to a high-risk state, they need to get tested or quarantined for 14 days. Frances, if the staff member chooses to quarantine instead of being tested, will they be paid from the federal coronavirus money?
Again, no, you will not. If you choose not to get tested, we will not pay you.
Okay, that was clear. Thank you.
And we really advise against traveling in high-risk states. I also think that's you risk putting a lot of people in danger. It's important that we try to follow the guidelines that are being given to us by our states, and that we adhere to those guidelines. EPS, we really advise against unnecessary traveling, especially if we understand there are circumstances that arises, but right now is probably not the best time to take a vacation to Florida.
Yeah, and Sabrina, you can probably speak a little bit more to this, but I know people that have traveled, they come home on Sunday night, Monday morning get tested. What about an incubation period there? Is that test necessarily accurate that they received, the morning after being on an airplane or being in a high-risk state?
Definitely. So the Massachusetts guidelines allow residents to get a test right when they return. So sometimes that we do see that they come home on a Sunday, get tested on a Monday, have their results, and are able to be back to work by Tuesday or Wednesday. It's still imperative that individuals monitor their symptoms for the duration of the 14 days. And if they start experiencing any other symptoms, any COVID-related symptoms during that 14 days, that they get retested.
Great, thank you. I wanted to mention that I've had calls from staff members who say that it's basically impossible to socially distance at work. I know that a lot of staff have struggled with this. Julie or Sabrina, can you two, one of you or both of you, speak to that, please?
Absolutely. I think it's definitely difficult to remain 6 feet away from staff, especially with students that we have and just trying to assist everybody. But it is a job requirement, especially with this new world that we live in. It's better to be safe than sorry, and you absolutely should be 6 feet apart at all times.
Okay.
And I definitely agree. I know it's very difficult, especially with smaller children, and we're very used to helping as much as possible, but we really need to take all of the preventative measures and follow them so that we can help stop the spread and really wear our mask, hand wash, stay 6 feet apart as much as possible, and really taking all of those preventative measures that Julie had mentioned, by taking a computer and going back to the proctor's desk. All of those measures together can really help limit the spread.
Thank you so much. A lot of people have also asked about at what point would we be forced to shut down the e-learning centers or in-person instruction due to positive COVID-19 cases? Sabrina, do you have any information about that? You know, at what point do we have too many cases?
No, definitely. And I think that it's always a conversation. Julianne and myself, we're always in contact with the superintendent, and going on based off of the cases that we receive. I think it's important to really look at each case by a case basis and see where these students or staff members are contracting the virus, if they're related in any way, if they're related to the school building, or if they're doing extracurricular activities outside of the school building, that maybe they were on a sports team or something like that, depending on how those cases are related, and really look at all of the data determining of when we close a building. I don't think there's an actual number that says, okay, we've had X amount of cases that we're gonna shut down a school building. I really think we need to look at, because it may be only 2 cases, depending on how they are related, if we think that it did happen in a school building or on school property, or we may have 5 unrelated cases. So I think it really depends case by case basis and where we can contact trace and track down where they may have contracted it, and obviously speak with the superintendent and try to make the best decision for the health and safety for both the students and the staff members.
Great. I know I've enjoyed this conversation, and I hope that we've addressed a lot of the questions that I've had from staff and that, the staff may be wondering about. Now I'd just like to provide you the opportunity, if you have any last thoughts or things to mention. Julie, would you like to go first?
Yes, as the e-manager, I see how hard our proctors work at assisting students and making their days as successful as possible. They really do go above and beyond. I know we all want to bring a sense of normalcy into the e-learning centers, but please, let's not forget to wear our masks, remain 6 feet apart, wash our hands, and sanitize as frequently as possible.
Great. Sabrina?
Thank you. Yes, I just want to say thank you to everyone for your work, your hard work that you do day in and day out. I know it's not easy. You just want to continue to take all of the necessary preventative measures, wear your mask, socially distance, wash your hands to help stop the spread of COVID-19.
Wonderful. And Frances?
The district want to say thank you for your hard work. We appreciate your hard work. We hear you and we see the hard work that you're doing every day. And we acknowledge that hard work and a lot of the things that we would not be able to do if it wasn't for people like yourselves who are coming to school every day, interacting with our students and giving them the best environment, making the best out of a very difficult environment for everyone at this time. Again, the Department of HR, we are here for you. If you have any questions, concerns as it pertains to your leave, we are here to, we don't want you to guess. We are here to explain things to you, and whatever we don't know ourselves, we will do our due diligence to find these answers for you. do not hesitate to contact us. And we are more than happy to help you with in any situation that we can and provide you with the best answers to your questions.
Terrific, thank you. I would like to just echo what these three ladies have said. I think the support for what I've been doing has been overwhelming over the past couple of months. It has been difficult for all of us. And I'm constantly amazed by everyone in the Everett Public Schools, just how wonderful you all are and how dedicated you are to our students. If you have any further questions, please don't hesitate to email me at jwhitson@Everett. You could also call me at the COVID hotline, which is 617-544-6806. I almost forgot the number. And please, again, refer to the Everett Public Schools website. Our webinar from the Summer Institute will be posted there. We have all of the guidelines, which we have updated and changed as the situation has changed, are there as well. And we just want to thank you for viewing this and for your patience and support all the time. Well, thank you everyone for joining us. I hope everyone has a great day and enjoy, I don't know what I was going to say, enjoy the month of November. Bye-bye.